Under the Affordable Care Act, the Department of Labor, alongside the Department of Health and Human Services and the Department of Treasury, was mandated to establish standardized forms for explaining health benefits. This mandate was part of the Public Health Service Act, which aims to ensure transparency for health plan participants, enrollees, and policyholders through clear, standardized benefits documents. The Department of Labor and the other departments developed the initial SBC, or Summary of Benefits and Coverage document templates and associated materials. Today, we are going to review the Summary of Benefits Coverage template. We are looking at a sample, and we're going to go over some common terms and discuss what the Summary of Benefits and Coverage really means to you and to your employees, and how you can use this document to compare coverage options for individuals. As we look at this document, you can see from the very top, it's a summary of benefits and coverage and what this plan covers and what you will pay for covered services. Beyond this, part of the heading should include the insurance company. If the plan sponsor is the insurer, for example, they're a self-funded health plan, then the name of the employer would be listed here. Or in lieu of the name of the employer, it would be the name of the plan. So it could be, employer name, health and welfare plan. You can include option numbers if there are multiple medical options from which an employee can select coverage. And then up on the top right of the screen, you're going to see the coverage period. In this example, the coverage period is between January 1st, 2022 and December 31st, 2022. It is common for a plan to extend 1 year. Not all plans are going to have a January 1st effective date. Plans can start mid-year. It is going to be dependent on the plan. Beyond the coverage period, you will see coverage for, and this would say their individual or family. In this example, coverage is extended beyond just individual coverage and will cover dependents. This particular plan is a PPO plan. PPO stands for Preferred Provider Organization. There are different kinds of plans, such as HMOs, which stands for Health Maintenance Organization, and they will work differently depending on the plan type. The beauty of the Summary of Benefits and Coverage document is that information based on plan type will be available in this document without the reader having to already understand those key terms. And these coverage documents are really designed so that there is consistency across plans, making it easier for individuals to determine differences in types of coverage. Previous to having a uniform template for summaries of benefits and coverage, insurers would have what is called a highlights sheet, or that's often what it would be referred to. And it would have similar information, but it would be listed differently. And it was never universal. And it was very difficult to determine the coverage differences between the two documents. For example, a highlight sheet might list the coinsurance as the amount that the insured member was responsible for, or as the amount that the insurer was responsible for, which would make it difficult to understand that coinsurance percentage, whether it was listed specifically for the individual insured or the insurance company. It should make it difficult to interpret, certainly. As we look at the Summary of Benefits and Coverage, I do want to discuss some common terms. You will see in each Summary of Benefits and Coverage a tabular format with columns in which the information is listed. This is on purpose. The first page is going to have why this matters. This will always be listed under page 1 of the summary of benefits and coverage. And the first piece of information is the deductible. All the pieces of information on every summary of benefits and coverage will be listed in the same order. That is part of what makes the document readable and translatable, universal, in order to be used to differentiate between coverage types so that individuals can make informed decisions. The deductible is the amount that a covered individual must pay before the insurance company pays. That's the easiest way to explain how a deductible works. In most cases, the deductible needs to be met before the insurance company will pay anything. There can be exceptions. We'll review that as we review this SBC. And then you'll see why this matters. Generally, you must pay all of the costs from providers up to the deductible amount before the plan begins to pay. A deductible can be a specific amount for an individual. So in this case, it's $500 for the individual or $1,000 for the family. To understand whether the deductible needs to be met for each individual first, or if just a couple individuals could satisfy the family, you'll want to look under why this matters. In this case, if you have other family members on the plan, each family member must meet their own individual deductible first until the total amount of deductible expenses paid by all family members meets the overall family deductible. In this example, only 2 people would have to meet this $500 deductible before the family deductible was met. So if there were 3 members covered on this plan, only 2 would have to meet their individual deductibles before the family deductible was met. And then the third individual would automatically have that deductible having been met. It can function differently by plan, so it is important to pay attention to the why this matters column. Are there services covered before you meet your deductible? Yes, preventive care generally would be. Sometimes primary care services would be covered before the deductible, and sometimes they would not. The information provided in this row is going to be specific to your plan. And in general, it should have preventive care covered. And then anything else covered before you meet your deductible is really dependent upon that specific plan. It's going to have additional information under why this matters. As you can see on this SBC, we have a lot of blue words which are underlined. Clicking on any of these blue underlined words will take you to a website with information on all of these terms, just again to make it more universally readable and understandable so that all insurers are providing consistency in the delivery of information, the type of information, and all of the terms have the same meaning with respect to your medical coverage. Are there other deductibles for specific services? In this example, yes. For prescription drug coverage, it's a separate $300 deductible. It's separate because it's listed here, and that means it accrues separately. In other words, whatever you pay for prescriptions, you would pay the first $300 for prescriptions before the plan would kick in this example. If you've paid for doctor copayments, none of those doctor copayments are going to count towards the prescription deductible. It's a separate deductible. It accumulates separately. This plan also has a separate $300 deductible for occupational therapy services. In this case, if there are any occupational therapy services, you have to pay the first $300 for those services, regardless of how much you've paid for drugs or how much you've paid for other covered services under the plan. Still have to meet that separate deductible. You pay all of the costs up to the deductible amount before the plan begins to pay for the services. The out-of-pocket amount on this plan for network providers is $2,500 for an individual or $5,000 for a family. And for out-of-network providers, it's higher, $4,000 for an individual and $8,000 for the family. Under why this matters, you can see that it's the most you could pay in a year for covered services. If you do have other family members enrolled, they do have to meet their own out-of-pocket limits until the overall out-of-pocket limit has been met. You can see a separate amount for in-network providers and out-of-network providers. That means that they're separate buckets. They accrue separately. Anything that you pay towards in-network providers will not be counted towards any amount that you pay for out-of-network providers, and vice versa. When we look at information based on network providers, this is going to be part of the general terms in that SBC glossary of information that we have. And so when we look up from those terms, if you were to click on that link, what is the, for network providers, that link is going to direct you to an outside website that provides information on network providers, or also sometimes deemed preferred providers. You'll see it's a PPO, preferred provider organization. And all that means is that a network provider has a contract with the insurer or the plan, and they have agreed to provide members, excuse me, to provide services to covered members of a plan. You're going to pay less money in general if you see a network provider than you will if you see an out-of-network provider. That's why they're also called preferred providers or participating providers. Your SBC should also have a link to the provider network or a link of the search engine, which will help you determine whether your provider is in network. It's going to be important information in determining if this plan is right for you. Different plans can have different networks, even if it's the same insurance company. Some insurance companies might have a more open PPO network, and they might have another plan that's on a more limited network, a narrower network, meaning there are fewer providers in network. And often when there are fewer providers in the network, the costs are lower, and that impacts your premium. What isn't included in the out-of-pocket? This is very important information to know. For this plan, co-payments are not included in the out-of-pocket limit. And that means even if you meet your out-of-pocket maximum, which says it's the most you could pay in a year for covered services, you're still going to keep paying for your co-payments for any services that have a co-payment. Those are going to be listed on pages 2 through 4 of your summary plan, summary of benefits and coverage. Anything that you pay that is not part of your out-of-pocket limit means that you're going to pay it. Even if you've met your out-of-pocket limit, it's still an expense that you can expect to pay and be responsible for. You will never have premiums counted towards your out-of-pocket limit and balance billing charges. And then your out-of-pocket limit won't cover any services that aren't already covered in the plan. For example, if your plan does not cover acupuncture, it does not matter whether you have met that out-of-pocket maximum or not. You're not going to get that acupuncture covered by your plan. It's just not covered. It's listed as an exclusion. Common exclusions will be listed in this summary of benefits and coverage, but not all exclusions will be listed. On the bottom of your summary of benefits and coverage, you should have a link to a certificate of insurance or a certificate of coverage document that has more specific details. Depending on the timing, it could be a generic certificate of coverage document that hasn't been prepared for your specific plan, or maybe it was prepared for a similar plan in a previous year, but it will be updated. It should be updated within 90 days of when your coverage goes into effect, so that you'll be able to access the specific certificate of coverage or certificate of insurance for the plan. If you click on the link and it's not available, it's more of a generic certificate of coverage. You can request that document from the insured directly. You can call the number on the back of your card, or you can talk to your employer, speak with someone in human resources, and let them know that you would like a copy of that certificate of coverage or certificate of insurance so that you can have more specific and detailed information on the plan. This plan does use a network of providers, and because it does, it specifies that you will pay less if you see a network provider. And then there is a space for the website to search for a network provider. As we move on to page 2 of the SBC, we can see that there was an important question from page 1 that was not answered. Do you need a referral to see a specialist? Yes, in the case of this specific plan, this example plan, yes. If you do not have a referral to see your specialist, the plan isn't going to pay for your specialist office visit. It's very important for you to know, because if your plan requires a referral, you would need to go to your primary care physician, the doctor that you normally see, and ask for them to submit a referral to a specialist. Otherwise, it won't be covered by the plan. If it's not covered by the plan, it doesn't count towards your deductible, and it doesn't count towards your out-of-pocket costs. Next, I want you to see this very important line. We can see an exclamation point right here. All copayment and co-insurance costs shown in this chart are after your deductible has been met. If a deductible applies, that's very important. Oftentimes, somebody will read an SBC and see a copayment amount and assume that that is the amount that they will pay, when in reality, that's not always the case. The deductible isn't always waived for copayments. Sometimes your copayment doesn't apply until after your deductible has been met. As we can see here, for primary care visits, there's a $35 copayment per office visit and a 20% coinsurance for other outpatient services. The deductible does not apply. This is very helpful to know. They specified that the deductible does not apply for a primary care office visit. And also the way that this SBC is worded, the deductible wouldn't apply for the coinsurance for the other outpatient services. Why would you have to pay $35 copayment for your office visit and an additional 20% coinsurance? Well, not everything in your office visit is covered under that standard office visit. If they have to draw blood, for example, that is considered a diagnostic service and it is separate from your office visit. If they perform an X-ray, it's another diagnostic service. It's separate from your office visit. So your office visit does include that visit with your provider. If you end up seeing multiple providers or you have any other services there, that is going to be subject to coinsurance for those outpatient services. It'd be rare for you to see a separate physician in your same visit. Usually, if that's going to happen, you would have 2 separate visit appointments included, because the nursing staff would generally be covered as part of that office visit in addition to the physician or physician assistant. As you'll notice on this SBC, a specialist visit does have a $50 copayment per visit. However, it does not say that the deductible does not apply. That means for this plan, you're going to pay for the full visit until your deductible has been met. Once your deductible has been met, then you will pay $50 copayment each time you see your specialist. Preventive care screening, there is no charge for that in this plan. If you see an in-network provider, notice that there is a separate out-of-network provider column that does specify the benefits and that they are different if you see an out-of-network provider. For primary care, even though the deductible doesn't apply in this case, there is a coinsurance and the deductible absolutely does apply for an out-of-network provider, since it does not specify that it does not apply. Therefore, we would go up to this higher heading and see that, yep, you have to meet your deductible first for anything unless it otherwise says so. There aren't any limitations, exceptions, or other important information listed under primary care visit in this example. However, we do see again, pre-authorization is required for a specialist visit. If you don't get that pre-authorization, benefits could be reduced by 50% of the total cost of the service. That pre-authorization process is going to be part of the process of the referral to that specialist provider. And then for preventive in network, there's not a charge, but if you go out of network, it doesn't matter if it's a preventive visit, there will be a charge for that service. If you have a test, your test is going to be billed in one of two categories. You will have something such as diagnostic test, which would be an X-ray or blood work, like we talked about for a primary care office visit, or you would have more advanced imaging, like a CT scan, PET scan, or an MRI. And you can see here that the benefit is different based on the type of test. In both cases for in-network, there is a copayment. That copayment doesn't apply until your deductible's been met. So you're going to be paying for 100% until you've met that deductible. And again, on this plan, that is a $500 deductible. Although remember, there's a separate $300 for occupational therapy services and another separate $300 for prescriptions. So you would have had to meet that $500 deductible before you have access to these copayments. Generic drugs, preferred brand drugs, non-preferred drugs, and specialty drugs are all listed separately. And having this SBC is very helpful because oftentimes other information illustrating plan benefits aren't as specific, and so it can be confusing. It's helpful to have it listed in this way, where we can see generic drug would also be listed under Tier 1. It is a $10 copay per prescription. Not until you've met that $300 prescription deductible, though. You're going to be paying 100% until then. But once you've met that $300 prescription deductible, it would be a $10 copayment for generic, $30 copayment for preferred brand, and then a coinsurance for non-preferred brand drugs and specialty drugs. If you have an outpatient survey in this surgery, in this example, there is a facility fee. It's a $100 per day copay once you've met that deductible. And there is a pre-authorization required. If you don't get that pre-authorization, your benefits could be reduced by 50% of the total cost. The other 50% would be considered a balance bill. And as we know, balance billing charges are not included in the out-of-pocket maximum, so that will not count towards the limit of what you would pay for covered services on this plan. Continuing on, we're going to see information about emergency room care, emergency room transportation. That would be ambulance or air ambulance and urgent care. All of these services are subject to the deductible because it does not specifically say deductible waived. Even this urgent care copay, you have to meet that deductible first. And again, there's a separate distinct benefit for out-of-network providers. You want to pay attention to these terms in an SBC. You can see a facility fee, and there's an example listed here, like a hospital room, and then physician surgeon fees. When an individual has a surgery, you will have a fee for the facility. That's the place of the surgery. And you're also going to have separate fees for the physician and the surgeon. And the anesthesiologist is going to be a separate physician that will be listed on your bill, and that all applies. So this is going to tell you how that surgery would be covered based on the insurance. Again, pre-authorization is required. It's important to pay attention to that. And then you can see that for the physician surgeon fees, there's a 20% coinsurance after the deductible normally, but for the anesthesia portion, it's a 50% coinsurance. So you do have a greater cost for that anesthesia and the anesthesiologist fees. This plan does have services for mental health, behavioral health, and substance abuse. And you can see here that there is an office visit copayment and a separate coinsurance for other outpatient services. And this would be subject to the deductible because it does not have wording that the deductible is waived. Inpatient would be if you're actually admitted. So in the case of mental health, if you were admitted to a substance abuse disorder facility inpatient, so you're going to be sleeping there, then that would be your inpatient services. A behavioral health center, anytime you will be there for more than just a visit, an office visit, it's going to be considered inpatient services. An office visit would be a visit with a psychiatrist or a counselor where you would go to their office, have the visit, and then you're free to leave and go back home or to work or wherever once your visit's done. But if you are confined to their facility, you're going to be looking at an inpatient service. If you're pregnant, I know this one can be really confusing. The office visits for pregnancy are separate. So in this instance, the office visit is going to be subject to coinsurance after your deductible. Same with the childbirth and delivery professional services, and then the facility services. So as we can see here, if you are pregnant, if you're going to have a child, you're going to have to first meet that $500 deductible, and then you're going to pay coinsurance after that. And then if we come back here, you could see that the most you're going to pay for covered in-network services would be then that $2,500, and that would help you budget. We're actually going to look at the last page where it has an example based on pregnancy and delivery and how that would pay out under the plan. And then if you need help recovering or have other special health needs, home health care, rehabilitation services, habilitation, skilled nursing, durable medical equipment, hospice, et cetera, it's a coinsurance after deductible. And then we can also see that there are separate visit limits. So for home health care, you cannot have more than 60 visits per year. For rehabilitation and habilitation, it's 60 visits per year. That would include physical therapy, speech therapy, and occupational therapy. So if you have 30 physical therapy visits and 30 speech therapy visits, you no longer have any visits left over for occupational therapy. And if we remember, occupational therapy also does have a separate deductible, which would apply to those services. And that does not mean it's going to have a separate visit limit. That visit limit is going to be combined, as we see here. Common question I get is, what is the difference between rehabilitation services and habilitation services? Rehabilitation services are designed to help somebody gain back a skill that they lost due to illness or injury. Habilitation is not helping to regain, but helping to learn. As an example, if you have an injury and you hurt your shoulder and you've had a surgery, you might have rehabilitation in the form of physical therapy to help you regain strength and mobility in your shoulder. If you, on the other hand, were born with a inability to use your arms, then you've not lost something. You didn't have it to begin with. And so then to get that range of motion in your arms, it would be considered habilitative services. It's probably not a good example. Speech therapy would be a better example. So if you were able to speak and you had a stroke and then you couldn't speak and you had speech therapy, that would be rehabilitative. If you are learning to speak and you've not successfully been able to, and you need help from a speech therapist, then that would be habilitation. So habilitation is you didn't already have the skill and you're trying to learn the skill. Rehabilitation is you had the skill once, you don't have it, and you're trying to relearn it again. So that's really the biggest difference. Skilled nursing care, that's going to be care from a skilled nurse, and you need additional care beyond just a regular visit, and that is limited to 60 visits per calendar year as well. Durable medical equipment, that's going to be like crutches. Crutches would be a durable medical equipment. It is equipment, and it's expected to last beyond just a single use. Gauze is not going to be durable because you use the gauze and you're not going to be able to reuse that. So even though that might be considered a medical supply, it would not be considered durable medical equipment. Durable medical equipment is, again, it's going to be something that could be reused in like a breast pump, for example, for milk would be considered durable medical equipment. Crutches, wheelchair, would be durable medical equipment. Syringes for insulin would not be durable medical equipment. That would be usable medical supplies. It's not covered the same as durable medical equipment. And I just wanted to point that out. Hospice services, the SBC shows in this case that pre-authorization would be required in order for hospice services to be covered. And this particular plan does have coverage for children's eye exam and glasses and even a dental check-in. Not all plans will have this. If they do, it will be listed here. You can see that it doesn't say that the deductible is waived, so that means that it's still subject to your general medical deductible before coverage kicks in. And then there is a limitation of one exam per year for each of your children, and one pair of glasses per year for each child in this case. Moving on to page 4, we're going to see some information about excluded services. Again, this is not going to be a full list. You would have to check your policy or plan document for more information and a list of any other excluded services that should be listed on a certificate of coverage or certificate of insurance. Again, you should be able to see that on the bottom of your page with a link to that information. If that link isn't working for you and you've not been mailed a copy, please reach out, call the 800 number on the back of your ID card, or speak with your human resources department so that you can get a copy of that plan document. In this example, cosmetic surgery isn't covered. That's very common. Cosmetic surgery is not typically covered in any plans. It's considered not medically necessary if it's cosmetic, so it wouldn't be covered. Dental care commonly wouldn't be covered for adults in a medical plan. Same with infertility, long-term care, non-emergency care when traveling outside of the United States. There are, again, lots of different nuances and variations between plans. So it's important for you to look at your specific plan in determining what will and won't be covered there. In this case, there are other limitations. As we saw, there was not a specific row addressing acupuncture or chiropractic care, hearing aids, and the like on this SBC. So it does call out that there are going to be limitations to some of these other covered services. And if you want to see those limitations, you're going to have to look at it through the plan document. Every SBC will also have language about your rights to continue coverage through COBRA, if COBRA is available to you based on the size of your employer, or any other reason that you might be able to continue coverage because it's a continuing care for a condition that you were being treated for and you've changed plans, but you're with the same carrier. So they're going to have a little bit of information here, and then there will be more specific information about your rights to continue coverage in your plan's summary plan description, also called an SPD, which is different than your SBC. And it will have more specific information for you regarding your rights to COBRA or other continuation of coverage rights under USERRA or FMLA as applicable. If you want to know more about that, you do need to speak with your employer, or you need to request a copy of the summary plan description, which will include that information. Also, you do have the right to appeal any decisions. If something is not authorized, if your pre-authorization for a surgery is denied, as an example, you can appeal that denial, and you're going to be able to see the specific language on your appeal rights in that plan document, and they're going to have information on that process. At what point are you eligible to appeal a claim? And do you need to do that in writing or over the phone, or is there a specific form? And it's going to have that information. It's required to be in that summary plan description. So you should have that there. And then other important information: does this plan provide minimum essential coverage, and does it meet the minimum value standards? If the plan does not meet the minimum value standards, then you may be eligible for an advanced premium tax credit on the exchange based on your household income. That's important because even if your plan does provide minimum essential coverage and that minimum essential coverage is affordable, if the plan does not also meet minimum value standards, then you might be eligible. Again, it's based on household income, and also there may be some other requirements there for you to know whether you are eligible or not, you would be able to contact your marketplace, and you should have a link to your marketplace on the SBC. If you're not sure where to go, then you can certainly reach out to your employer and you can ask them questions. Or if you look up the marketplace insurance near you, you should be able to get some additional information. And then there is a federal marketplace website where you can go that will direct you to the specific marketplace in your state if you're not sure. A marketplace is also known as an exchange. It's where you could potentially get individual coverage outside of your employer. And that's also where you'd have to go through to see if you would be eligible for any advanced premium tax credits or subsidies. Any language services that are available will be listed in your SBC as well. And then now, lastly, the final page of the SBC will have information on 3 different scenarios. In this case, Peg is having a baby. We can see that the plan's overall deductible is $500. And then we can also see a specialist copayment listed here of $50. The hospital facility coinsurance is $20, and then the other coinsurance is $20. In this example, it's not listed out specifically. Unfortunately, it would be great if it had more detailed information, but I know that the departments were also looking at overall time that it would take to prepare this information. And so they've decided on some standardization of these examples. What we can see is that the total example cost for Peg's pregnancy, labor, and delivery is $12,700. She's going to pay that first $500 deductible expense. She's going to have, in this example, $200 of copayments, and then she will pay out $1,800 in coinsurance. And in this example, there's $60 that it was not considered a covered service under the plan. So that will be her responsibility, irregardless of the out-of-pocket maximum. And we can see here that the total Peg is going to pay in this example would be $2,560. $2,500 is the individual out-of-pocket limit, but $60 was excluded from coverage. It wasn't a covered service, so she's going to have to pay that $60 anyway, even though it is over the individual out-of-pocket maximum. In our second scenario, we have managing Joe's type 2 diabetes. And this example looks at a year of just routine in-network care. Also, I should say all of these example scenarios are going to be looking at in-network. They're going to assume that any pre-authorization requirements have been met. And they're also going to assume any referral requirements have been met. If any of that is not true for your specific case, these examples won't apply. Excuse me. As we can see here, in this case, Joe's diabetes for just that routine in-network care is going to cost about $5,600. His responsibility for the cost after his deductible, copayments, and coinsurance is going to be about $1,820. And there are $20 in coverage, which are considered not included as part of the plan. In the third and final example on this SBC, we have Mia's simple fracture. So Mia had a fracture, and between the emergency room visit, the x-ray, the crutches, and the physical therapy, the cost is $2,800. And of that, Mia would pay $1,100. We don't see any limits or exclusions as far as services that are not covered, but we do see that her deductible was applied, and then copayments and coinsurance. In all of these examples, the total example cost exceeds the cost to the individual, which is why we have insurance, because insurance helps us pay for those unforeseen costs. However, we do see that even with health insurance coverage, it's important to understand what each service is going to be applied towards, whether that's going to be applied toward a deductible, a copayment after the deductible has been met, or coinsurance, so that we can plan accordingly and save for what we need to cover our medical expenses. These examples can be very helpful in determining what plan might be best for us. Additionally, please pay attention to the network of providers. It's important to understand whether your providers are even in the network when you're looking at plan options and plans from which you can choose. It's also important to note if you plan on needing to see a specialist, whether that referral will be required. Some plans also do require you to designate a primary care physician, and you can only go to that specific physician. If you see a different physician, they're going to count it as not authorized and not treated. It's important to pay attention to all of that information. If you do have a plan that requires you to name a specific physician to be your primary care physician, they are required to provide you a notice informing you of that requirement so that you can plan accordingly. I hope you learned something from our review of a summary of benefits and coverage. If you do have any specific questions, or if you think I should cover this in more detail in a future session, please leave a comment and let me know. With that, I'm going to let you get back to the rest of your day. Take care.